And thank you so much. When you find out you're pregnant for the first time, there are so many fun questions to answer, like, will it be a boy? Will it be a girl? What should I name my child? And then there are the embarrassing questions. Dr. Candace Nielsen from Lakeview OBGYN has compiled a list of the top pregnancy questions first-time moms may be too scared to ask. And not only are these embarrassing questions, I understand the sources can be contradictory.
Yes, definitely. You know, I think a lot of people, when they first find out they're pregnant, they go to the internet, which can be good, but
Google.
also can be bad. Yeah, exactly.
Google, a doctor's worst nightmare sometimes.
Yes, it can be. You know, there are great websites out there too, but I think the best is to kind of ask your doctor. But some of these questions are a little embarrassing for
Well, we're going to ask you. I guess I'll ask the embarrassing questions then, and hopefully alleviate the embarrassment of women everywhere. The first question, we're talking bathroom blenders. So we'll just put it out there. Is it normal for a woman who's pregnant to struggle controlling her bladder?
Yes, I think urinary incontinence is one of the most common things that people are afraid to ask about, but definitely if you ask them about it, they'll say, oh yes. You know, I think even after you've had children, the trampoline is often the biggest issue for people.
That's a no?
Yes. But for pregnancy, you know, there's a lot of things that are going on. One, the baby is growing, your uterus is growing, putting a lot more pressure on your bladder, so the bladder can't get as full as it usually does. And then when you cough, laugh, sneeze, that kind of stuff, you're going to leak. Also, childbirth itself can cause damage to the perineum or the muscles down there, which makes it a little bit harder either to go to the bathroom so you can have urinary retention, or the opposite, urinary incontinence, where you leak.
Gotcha.
That stuff usually goes away postpartum. You know, a third of women still have symptoms by 8 weeks. You know, and some women, it can take a whole year after having a baby for your bottom to get back to normal.
A whole year? Wow, okay.
And you know, sometimes it never does, but you can do things like Kegel exercises where you strengthen those perineal muscles to kind of help. It's best to do those before you cough, laugh, or sneeze. So we always say sneeze before you squeeze, or squeeze before you sneeze. I got it backwards. But basically to kind of help control your bladder a little bit better.
A lot of celebrities come under fire during their pregnancy. Most recently, I'm thinking of Kim Kardashian, for how much weight they put on in those 9 months. How much weight is normal during pregnancy?
For a normal person, normal body weight, you should probably, you know, aim for 20 to 30 pounds.
Okay. For
somebody who's underweight, so somebody who already probably needs to gain weight before they get pregnant, you want to go more towards the 40-pound.
Okay, when a woman's water breaks, oftentimes in the movies, this is portrayed as this big dramatic Niagara Falls of a scene. Is that really the case?
Sometimes people do have a big gush. Most of the time, though, it's a little trickle. So what I tell my patients is, if you feel like maybe your water's broken, but you're not sure, maybe you just wet your pants. What I say is change your underwear, change your pants. If it happens again, it's probably your water is broken and it's just a little leak. So then to go in.
Any drawbacks to an epidural? I've heard of increased tearing sometimes in that situation.
I don't really think the epidural changes how you tear or not. The best thing is to try to have a controlled delivery as the head and the shoulders come out. Some people, an epidural does help with that because pain is a big issue in terms of how controlled you can push towards the end. So some people it would help, but other people, you know, can do it well on their own. Some tearing is normal for a first baby, though. We kind of expect that.
Okay. We have just scratched the surface. There are answers to many more common questions I know on the Mountain Health Star blog. Where can women go to get their questions answered?
I think that is a great website. Also ours at www.lakeviewobgynClinic.com. That kind of has where our blogs are. We have a lot of stuff on Facebook as well. And then obviously you can call and make an appointment either with me or another OBGYN. So
it's nice to just have those candid conversations. So thank you so much.
No problem. Thank you so much.
All right, coming up, a special interview you won't want to miss. We'll share the details next.